Hello, everyone. It has been an exciting day with so much incredible information shared. So just really humbled to be here. So really, my conversation today, I want to center around, what I kind of call the path to improved clinical care. Wearable technology, designed to improve health, are pretty ubiquitous these days, used by millions across the world, but for some very good reasons that have, I think, been outlined, today. The wealth of data generated from these sensors has not really transformed routine clinical care. I won't have time today to kind of dig into the barriers related to, standardization, transparency, interoperability, and reproducibility. But despite these challenges, I think there's some really exciting research happening. And if today is any evidence of that, I think we're, in for, I think, a treat in the future. And I do believe that a lot of the research that's ongoing right now will inform the future of clinical care. So just in terms of the program for today, I'm going to explore the value of mobile data in clinical care. I'll give a description of WHOOP technology, and I really want to dig into two promising applications of digital phenotyping. The first study is called Impact, and we're deploying remote monitored patient data, and really with a goal to avoid cancer treatment toxicity. The aim will be to develop real-time algorithms that allow for checking and detecting alarming pattern changes in daily functioning and biomarkers to predict when an individual shifts from being at risk to a patient that is about to experience an episode in need of immediate care. The second study, case study 2, the study aims to assess the clinical correlates of sleep and cardiovascular outcomes in persons with substance use disorders. The goal is to determine the association between cardiovascular parameters, sleep behaviors, auto-classified activity behaviors, as well in-app microsurveys to assess stress, craving, anxiety, and depressive symptoms. While these two applications of digital phenotyping are distinct, I think the former provides insights into how exposure to chemotherapy and radiation therapy affects patient health as measured passively across multiple biometric variables collected by WHOOP, while the latter will also aggregate biometric variables, but will also include short microsurveys delivered to the smartphone or in vivo data collection. Thanks to Anella, we now have a name for this, which will prompt the patient with short questions a few times per day related to stress, as I mentioned, stress, anxiety, and depressive symptoms. Just a quick note about me, my disclosure, I am the Vice President of Performance Science at WHOOP. I started out as a U.S. national team athlete, collegiate athlete, a NC2A coach, and now the VP of Performance Science. And really early on, I was so inspired by the promise of technology as a way to foster human performance. And this is what led me to WHOOP. I've seen WHOOP data and insights transform the careers of professional athletes and tactical athletes. And now the general consumer is benefiting from these data. I think, digital tools, I just have always believed that have so much potential benefits. And I see so many parallels in kind of this elite sporting space, really transferring to the general population. And I just think compared to traditional assessments, they're non-invasive, ecological, they demand less effort, and provide continuous access, which really offers timely understandings of how certain behaviors, in our case related to sleep and recovery and activity, might contribute positively or negatively to one's kind of physical, mental, emotional, cognitive states. So really, I think when we consider the opportunity here, there have been, and I just wanted to point out, I wanted to mention, I think, related to, I think a lot of the challenges that we've seen with these data is that it's kind of only seen as being valuable at a population level. And I just wanted to point out our work that we've done around COVID, our just incredible data science team developed a machine learning algorithm using data that ultimately predicted 20% of cases before people were showing symptoms and 80% of all cases within 3 days of symptom onset. So I just, I think this really highlights the importance of, an individual's baseline. And again, we've seen this play out in kind of the sporting space, and now seeing it play out in the consumer space. But this individual baseline, I think, is so critical, because none of these individuals would have clinically triggered an alert based on vital signs, but change in baseline was really significant. So just wanted to point that out. There have been some exciting advances in healthcare, electronic connectedness or interoperability, which is, as many of you know, the process of kind of freely exchanging information among electronic systems. And as much as there have been exciting recent advances, data is still very much incomplete. The evolution of interoperability has made it increasingly easier to exchange, kind of like blood pressure, like chart level data, medication, lab results, but, between hospitals and physicians, but a huge chunk of patient activity is still missing. Literally their activity, their behaviors, the choices patients are making in between hospital or doctor visits, from water intake to sleep-wake timing to light behavior, activity behaviors, feeding windows, calories, timing of meals, cardiovascular load, activity levels, types of activities. I mean, the list kind of, really goes on and on. So when you look at all of the coordination required in a patient's journey from, the hospital to home, from the doctor's office to home, the glaring admission is like literally the home, which I think brings me to, I think what the core project is, is that mobile data is really, I think, the path to improve critical care, because it's truly the time away from the doctor's office and hospital stays that I think provides the most kind of salient bit of insight, if I think helping the whole patient is really the goal. And as I've said, I've really seen this play out over and over again in high performance sporting, where I've seen passive data collection and digital insights related to sleep and heart rate and recovery change athlete health and well-being for the better. And I know the same principles apply to healthcare. I think if we want to move from concept to practice and transform routine clinical care, we need to start to use these data as a clinical tool to support prevention, clinical decisions, and really create a new paradigm of personalized medicine. So just a bit about Whoop here. Whoop is a wearable device, and it has corresponding analytics system that really aims to unlock human performance, through this, continuous gathering and monitoring of physiological data. Whoop has been, as I mentioned, really influential in the early detection of COVID-19 and has been involved in research around neurodegenerative diseases and sleep. And as you can see in the picture here, we have data that's visualized for the individual. So they wake up in the morning and they're able to see their recovery, which in this case is on the screen. You can see it's 85%. And this is just an algorithm that we have that basically tells the individual their capacity to take on load that day strain, a summary statistical cardiovascular load, and their sleep performance. And we give super granular insights to sleep performance. And then you can see here, and I'm not sure if you can see my cursor, but there's also a concealed mode that we use for research. And basically what this involves is just, Whoop, as you can see the picture of Whoop, there's no watch face. So it allows us to really capture, super granular data, because there's no competition for our sensors. There's no text messages, nothing. We're just literally collecting data. So for the concealed app, the subject or the patient would only see kind of a home screen that shows them their charge level. So this allows us to obviously run controlled experiments because there is a significant Whoop effect where we get incredible behavior changes, behavior modifications. On the bottom part of the screen, you can see a health monitor. This is a new feature. And again, when I was alluding to just the importance of an individual baseline, the individual can monitor when there's deviations, substantial deviations off their baseline, and we alert the individual when that might happen. And then I know this is very small, but right where my cursor is, you can see share your health report. You can actually share your data with a physician or a trainer or whomever you want to see it, a partner or whatever, you can share kind of a health report. And there's also a journal behavior. So I mentioned surveys, and a couple of the case studies that we'll be doing, we'll be pushing surveys, these micro surveys to individuals. And so that actually, I think really improves compliance because they don't have to go outside and do a survey somewhere else, via email or in a different venue. It comes right to the mobile application. And you can see on the far right, just a raw data snippet. We also share with researchers for certain partnerships, raw data that they can use for their research. This is just a kind of a quick laundry list of the passive and active data collection that takes place on the WHOOP during the WHOOP experience. So tons of passive data is collected. 52 hertz, so it's super high fidelity, taking in tons of inputs, and then there's also an endless array of active inputs that we can source over the course of a study, for example. And then, this is just a snippet of, via API, we can basically take all of these passive and active, data and push them to a researcher. So this gives us, I think, a really nice, gives research teams just a really very clean way to get the data and then to have it and to be able to do, ongoing analysis as these studies are going on. All right. So again, I think there's just an incredible opportunity here to, for the quantification of these personal experiences, specifically around illness and recovery. And then, of course, the digital phenotyping to improve, health monitor response to treatment and inform intervention. We have an incredible opportunity to work with Dr. Vijos from Duke Medical. He's the principal investigator on this study. And really, what we're trying to achieve here with this study is really the identification of a non-invasive real-time biomarkers to predict treatment toxicity and clinical outcomes. And I think, if we're able to do this, it would constitute a significant advancement of therapeutic value. I think the management of acute and long-term treatment toxicity is substantial and really a growing problem. I think especially as the multimodal, local, and systemic therapies are prolonging survival. So, physical activity, as I forget who mentioned it, but there's a really good presentation that outlined this. Physical activity is really known to predict outcomes, including mortality, reoccurrence rates, length of hospitalization, and postoperative status. So I think clinicians and investigators, are currently really depending on subjective surrogates of functional status to assess physical activity, prognosis, tolerability of therapy, and even clinical trial eligibility. So, and these assessments are generally based on, episodic encounters, which undermined by recall bias and differences in perceptions between patients and clinicians. I think, and demonstrate actually a pretty low association with quality of life and symptom measures. So I think an accurate, real-time biomarker for functional status could really improve selection. And obviously this is, this is the kind of whole impetus behind, getting the study going, is I think the opportunity to, lower medical costs by, minimizing toxicity. So being able to predict that and the utilization of obviously the healthcare services and, reducing treatment breaks, and, hopefully, obviously, the goal to improve treatment efficacy and efficiency for cancer patients. All right, and then just moving to study 2. We're very excited also to work with Andrew Hun. He's out of Johns Hopkins, and the goal here is really to try to, construct some predictive models of individual vulnerability based on, kind of these, diverse sources of information. So as many of you know, substance use disorders are a pretty significant public health concern in the United States. And unlike a lot of other chronic health conditions, the treatment infrastructure for substance use disorders is developed separately from mainstream medicine, which results in quite a fractured system that lacks standardized outcome assessments. So while there have been several improvements to the medical treatments of SUDs in recent years, there's really an opportunity here to utilize biometric data and other digital phenotyping that can track the trajectory of physiological outcomes during SUD treatment, as of course of objective measures of healthy recovery, with a goal to identify risk before it's too late. So those are just, quick overviews. I know I'm down. This is just an overview of the protocol and objectives, as I kind of alluded to in my introduction. And, really, I think, in conclusion, that, wearables have, I think, the ability to drive action through really understanding of an individual's own physiology. So there's that piece, just understanding what is normal for the individual, for the patient. And then continuous data, when we know how to use it, just has a ton of utility. I think the real use is understanding these deviations in behavior and biomarkers from baseline. And hopefully we're in a better position to detect and prevent harm or disease. Thank you.